Okay. Will you spell the second part for me?
McKissick,
Yeah.
capital M, small c, capital Kississic.
Very good. Okay, thank you. Now, Dr. Brooks, tell me a little bit about you from as early as you want to until now. Okay.
Well, I was born and raised in Pine Bluff, Arkansas, the fifth of 9 children. My father was a Baptist preacher. My mother was domestic as well as a school teacher for a number of years. My mother was my inspiration to go into the health field in that she absolutely loved being pregnant. She loved having children, and she considered it as her job, if you would, to care for us and raise us, as my father would say, in the fear and admonition of the Lord.
Church.
You want to do what?
That's what I'm in the church. I'm trying to get some roses.
Okay. There may be somebody from the church down at the, say either in the kitchen. Check the lady right there. She can get somebody from you. Hey, he needs some help. Okay, all right.
My mother and father loved children. They felt that was part of their responsibility and reverence for the Lord when he said, "Be fruitful and multiply and replenish the earth." My father was a farmer. He was born and raised in Arkansas and grew up not only with regular things you would consider in the I'm about to cough.
Okay. You need your water? Make that statement again.
I just said my father was a farmer from the Delta of Arkansas, and so even when we moved to Pine Bluff, he continued to farm, had a farm in the backyard, and anybody who would have a vacant field, he would get their permission to plant a garden and harvest it, and we were the workers, if you would. But my mom just loved having children, so whenever she had a child, she said her arms would just jerk and yearn for the carrying baby. She had the babies at home, she breastfed. Actually, my father delivered me at home because the midwife didn't arrive in time. And so when they came, I was fine. But that's my upbringing, was a woman who loved being a woman, loved caring for the children and having the children. She breastfed us all till about 2 years of age.
Okay.
And I'll tell you a little story, I don't know if you would
Yes.
use it or not. But the story goes that before I was conceived, my mother, after she had that third child, had problems with bleeding. And the doctor had told her that she would have to have a hysterectomy because he had done all he could to stop it. And she said no, she did not want a hysterectomy. So my mother was listening to a radio evangelist one Sunday. She stayed home from church. As I said, my dad was preaching, so he went to church. And he asked, if you need prayer, put your hand on the radio, which she did. And she prayed. And she said the bleeding stopped at that moment. I was the next child that was conceived and born. And so the story goes that the devil was trying to stop my birth. And I was the one who became a nurse first, OBGYN physician
Beautiful.
and have delivered thousands of babies and have cared for countless women.
That is awesome.
Well, that's the way we were raised, to believe in the Lord
Mm-hmm.
and to also help others.
Okay.
And that's my family heritage.
Okay. Tell me about your church upbringing.
My father, again, being a Baptist preacher, he pastored many churches and usually had more than one at a time. But ultimately, when we settled in Pine Bluff, he had the one congregation, Mount Calvary Baptist Church, that he preached and pastored.
Is this Pine Bluff, Arkansas?
Pine Bluff, Arkansas.
Okay. Okay.
Pine Bluff, Arkansas. And we got involved, of course, in the choir, in the Junior Missionary Society, and Vacation Bible School. And I tell you, we love Vacation Bible School because for that week, not only would we play and color and create things that we could take home, but we also learned, I would say, the basics about the Bible, explained in very simple terms. Not just like Sunday school
Right.
or BTU training, but you got to make things that reminded you of the lessons that you had learned. So we always enjoyed Vacation Bible School. Even so, when my brothers and sisters had their children, we grew up and were away, every summer we sent our children, all the cousins, back to Pine Bluff.
Okay.
And my mother and father would house them in their home and take them to Vacation Bible School that week. And there would be pallets everywhere because there were not enough beds for them to all sleep in. And it's amazing that our children looked forward to that week.
Okay.
They called it Cousin Week,
Yeah.
not just Vacation Bible School.
Right.
And our children are still close friends with their cousins,
Okay.
even to this day. And
Great.
they have their children. And matter of fact, they've been trying to get me to do what my folks did. Why don't you have all the kids in the summer?
Oh, a man has really got to love children to entertain all of those cousins and whatever a whole week.
Well, they felt it was their responsibility to make sure that they became Christians.
Great.
Because it was not a desire of theirs that any should perish. And they wanted to see them all in heaven.
That's
And come and
That
bring
is
them
great.
someday.
That is great. That's awesome. Okay, now let's talk about midwives.
Okay. Well, let me just tell you, when I was growing up, because of my mother's positive experience about pregnancy, childbirth, and child rearing, I decided at age 6 that I wanted to be a nurse. And I wanted to help others in the health profession. So when I graduated from high school, I was 16 years old, and we were looking for a place that I could go to get my nurse's training. Now, I will tell you this, going to college was not an option in my family.
Okay.
Okay. Actually, my mother was one of my greatest inspirations. She, as I said, was a domestic, but she went to college, taking a course here and a course there. And when she graduated from college, she was 9 months pregnant with the 9th child. She walked across the stage, got a standing ovation, and all of us children were there. As a matter of fact, I vividly remember her having to walk to school, which was about 8 or more blocks from where we lived in Pine Bluff. And she had this PF Flyer wagon that she put the smaller kids in. And she would pull them over a gravel road
Wow.
to college. Now, it was AM and N college at that time as UAPB.
Mhm.
But when she would get there, she would leave the young ones in the wagon or in the hall, and the janitors would watch for them while she was in class.
Beautiful.
So that was my inspiration, if you would.
That is all right.
And of course, Daddy told us that we were all going to college.
Mhm.
And he said we could go by scholarship, or we could go by loan, or we could work our way through.
Okay.
But we had no option but to go to college.
That is great.
And so when I finished, I'm looking for a nursing school. And at the time, I was not aware of any nursing schools in Arkansas that would accept Negro students. That's
Right.
what we would call them.
Mhm.
And so I applied to Dillard, Hampton, Tuskegee, all out of state. But
Mhm.
remember, I was only 16 when I
Right.
graduated. And Mama kept saying she couldn't see herself putting me on a train with a one-way ticket
Mhm.
to college
Right.
and not knowing when she would see me again.
Yeah.
And so she kept looking in Arkansas. We found nursing schools, but they didn't accept Negroes. And finally, she went to the University of Arkansas in Little Rock and to the School of Nursing, talked with the dean, and the dean said they had started taking Negro students.
Okay.
And so that's where I ended up going.
Okay. Very good.
I was at the time, the school was integrated, but we had to do our first 2 years at the University of Arkansas in Fayetteville.
Okay.
And the schools were still segregated as far as housing.
Right.
And so we lived off campus. And I guess I'm making a long story short.
But that's all right.
Anyway, that's where I did my first 2 years was in Fayetteville. And then I got to come to the University of Arkansas School of Nursing in Little Rock.
Okay.
And I completed there in the 4 years and graduated with honors.
Beautiful. Beautiful.
I loved it, caring for the women. When I was in the clinical rotation, but it disturbed me when I would see the women yelling and hollering and cussing their babies and their labor, which was so foreign to what I had seen my mother
Yeah.
do. And even though she had her babies at home, except for the last 2, by then they had people coming to the hospital, she was still just positive about childbirth and labor, and that was foreign to me. And so I determined then that I was going to get additional education to try to help these ladies have a more positive experience with the labor and the birthing process so that it would carry over into their care
Right.
for the children once they were home. And so fast forward, I ended up being a clinical instructor at the University of Arkansas School of Nursing and left there to get my certified nurse midwifery training and master's in nursing from Columbia University in New York. I loved it.
Okay.
I loved helping the women prepare for the birth. I loved helping them learn about their bodies so that they wouldn't be frightened. I loved the smiles on their faces when they would say, I didn't know that. I didn't know that. And I loved actually delivering the babies.
Okay.
I mean, being with the woman, helping her understand so that she looked more forward to it, being there to bring the baby out, escort the baby if you would, and give it to the mother, which a lot of them would immediately put the baby to breast because we encourage them to go to childbirth classes. It was just a wonderful experience.
Beautiful. Beautiful. about the midwives, nurses training and all that?
Well, to be perfectly honest with you, I am a certified nurse midwife.
Okay,
But when I left New York, I said I did that until then. I moved to Jackson, Mississippi, and I became director of the nurse midwifery program here in Jackson at that time.
okay,
And we worked with the midwives who delivered babies in the home.
okay,
And we helped them learn more scientific information. And we helped them also to teach this to the mothers
mm-hmm,
so that they would be better able to care for themselves and for their children. And it was a very positive experience for the mothers, of course, and the midwives. Mostly I did it it was done in Lexington and in Hollandale,
okay,
and in Vicksburg.
okay,
Yes.
okay, all right. So in Vicksburg, would you have served the Satasha area?
Don't do me like that. I don't know.
It's a little village, used to be called a town, but I think the last reading of the last census, there were like 59 people there.
Oh, no.
So they had dubbed it a village.
I actually worked at Cuban Hospital.
Okay, yeah, I'm familiar with them, with that hospital. My grandparents and my father lived in Vicksburg, and two of my older siblings, and that's why I wanted to know about that. And we were birthed out at Satasha.
Ah, well, I wasn't familiar with that. I did know home birth.
Okay, all right. So everything went to, you took all of your cases to the hospital or to the clinic?
To the hospital.
Okay.
Now, there were others who did home births, but I
Okay.
did not.
Okay. Were you a part of the, yeah, now cut you off, go ahead.
No, I was just going to say, we worked with the granny, we call them lay midwives at that time.
Okay.
We helped educate the lay midwives in caring for the babies, in, again, educating the mothers. And many of them, we kept statistics
Okay.
on the outcomes. And we actually, there was a published article showing that the outcomes for the babies improved significantly with the additional training that
Okay.
was being done. And they actually were responsible for coaching the moms through the first 6 weeks. After postpartum, you know, 6 weeks postpartum, they come back to the hospital, if everything's okay,
Right.
then they would be released.
Where can I find that document?
I'll have to look for one. I know the public relations department at the university at one time
Mhm.
had copies of
Okay.
it, but I have not a clue now.
Okay. All right. Okay. Anything else you want to tell me? So you came to Mississippi during the time they were requiring certification for midwives, right? They had to go to school and
Yes.
get some training and
So
then come
the lay midwives or the grand midwives were then like I wouldn't say nurses' aides.
Okay.
But they were the ones that we educated to work with the mothers, giving them more information on the labor, the birthing process, and caring for the babies postpartum.
Okay.
So they were actually assigned to work with them up until 6 weeks postpartum.
Okay.
They were, the health department actually trained them and schooled them prior to the certified nurse midwives working with them on sanitation, hygiene, caring for their bags and things like that.
Okay.
And so the health department had started doing that prior to my coming.
Okay.
And the nursing midwifery program at the University Medical Center is where we train them more on the care for the mother and baby after delivery.
Okay. Okay. Very good. Very good. So this was going on what area? Like 19.
I came in 74, 75.
Okay.
Yeah. And
Okay.
we, like I said, we were Vicksburg, Hollandale, Mount Bayou, Lexington.
Okay.
Those are the areas.
Yeah, that's good. All right. Well, Mount Bayou had at that time a clinic there then.
That is correct.
Okay. Okay. Very good. Very good.
And most of us, like I said, were certified nursing wives.
Okay.
That worked in the hospital.
Okay. Very good.
Now, after I worked for a period of time as a certified nursing wife, as I like to say, I hungered and thirsted to know more. And so that was when I made the decision to become a physician.
Okay.
So I left there, university at that time, went to Jackson State and got my pre-med requirements completed.
Okay.
And then, gained admission to the University School of Medicine.
Okay.
And so I completed 4 years there in medical school. And I went to the University of Tennessee and did my board certification, did my residency.
Okay.
So I left medical school here after completing the University of Mississippi, went to the University of Tennessee in Memphis, and completed my 4 years for obtaining my
Okay. Very good. Very good.
well,
It's just
I'm just trying to think about it. I'm not sure what I was about to say, so you can cut this out.
okay.
But I did 4 years at the University of Mississippi, getting my MD degree, and then did 4 years at the University of Tennessee, and finished my residency, and began working as an OBGYN. And so I became board certified in obstetrics and gynecology, and have continued to work there. So one of the things that I say, people say, well, why didn't you just leave high school and go to medical school and, skip all of that? My response is, I wouldn't be who I am today if I had done that. I had to become a nurse and fulfill my desire to work with women directly, as my mother had inspired me to do. And it's because I did that, I say that I was a different kind of OBGYN.
Okay. Okay.
People teased me and said I was still a nurse midwife, and I was still a midwife. And I said, yes, I am, because that was my motivation for going into the health field in the first place,
Okay.
was to work with women, having their babies so they'd have a positive laboring and childbirthing experience, which would roll over into them caring and raising their children.
Very good.
And my mother and father were my inspiration to do that. And so I continued, I say being a midwife, a nurse midwife, even though I had the OBGYN certification, it was called doctor, but I thoroughly enjoyed it. I literally cut my teeth on the vision and the inspiration of being a midwife, which is with mother and child.
Right. Oh, that's
And
why.
that-
I guess that's why your patients fall in love with you.
Well, that's why when became aware of this project,
Yeah.
I knew I had to be a part of it. And because it's so vital that we don't forget, A, where we come from, and B, that we don't forget the contributions that were made during that time, and wonderful experiences that occurred because of the passion and the love that the midwives had for their patients, the mothers and the children, and the families. It wasn't just about here's a baby.
Right.
It was the whole family that was of concern.
Beautiful. Yes, yes. Okay. Well, is there anything else you want to share? Just think of anything that can you think of, or do you have a list of midwives someplace?
I'll bet probably in some archive, the health department. would
Yeah, I've
probably-
got to call in to Miss Fields for
Okay.
Monday, so I'll be checking with her for that.
And I don't know where the records are for the university program because it closed after I left.
Mhm.
But I'm thinking somebody at the university.
Dr. Barnes
may even
may be able to tell.
may be able
Yeah.
to do that.
Mhm,
Yeah.
mhm.
Because I know those records have to be somewhere. They probably are on microfiche by
Yeah,
now.
yeah.
But still, those records should be
Keep it.
somewhere.
Yeah, right. Mhm.
Even the article that we were talking about should be able to be retrieved.
Right. Okay. Very good. Very good. You're still working, right?
No, I actually retired last
Okay.
year.
Oh,
If
okay.
you consider from the time I completed nursing school to the time I retired, let's see, I was 20 years old when I finished nursing school, and I was 17 years old when I retired. So I
Okay.
have about 50 years
Okay. That's beautiful.
of
That is
practice in medicine and nursing.
That is beautiful. I'm sure you have inspired a lot of women to go into nursing.
Well, I have not only into nursing, but a nurse practitioner as well as medicine. And I have to attribute my entrance into healthcare because most of my family are teachers. We have a lawyer. We have, trying to see, working in education, social worker. I have 3 brothers that are preachers, so they took after my father. And my point is, though, that I was the only one that went into the health field, and I really believe it was because of me observing how my mother responded to being pregnant, labor, delivery, and childbearing.
Okay.
It was her calling, and it inspired me significantly. As a matter of fact, I'll tell you this whole story. My husband and I both are the 5th of 9, and so we decided we wanted 5 children to at least replace ourselves. And so when we decided that I would go to medical school, we had 2 children. And so we decided, well, we better hurry up and have a 3rd. So while I was at Jackson State doing my pre-med requirements, we had a 3rd child. And then my sophomore year of medical school, we had a 4th child.
Okay. That's great.
Well, I mean, I figured I couldn't do it once I got,
Right.
further along.
Right.
So then, and then we, in my senior year, we miscarriage. So we did get 5 children,
Right.
but 4 lived.
Mm-hmm. That is
But
beautiful.
it was, my mother came and stayed with me for the birth of each of those children.
Oh,
And that last child that I had, so they drove from Arkansas, my dad brought her over. It was during exam time, and so my father would drive me to school to take my exam, would wait for me in the hall, and then take me back home. And Mama was caring for the children and for the child, the baby, while
okay.
I was going to class. They say I was the
That's
only
awesome.
student they ever had to have their daddy still bring them to school.
That is awesome. That is awesome.
That's my positiveness, if you would, about childbearing, but also about the midwife experience, you know, because of my mother and her positive experiences, it inspired me.
That is great.
And so that's why I became a nurse and a midwife and subsequently became a physician,
Okay.
so I could do more.
Tell me now, when you were working with the ladies, did you wear a uniform or anything, a cap?
Yes.
Okay.
Yeah. We wore uniforms similar to the public health nurses.
Okay.
But, I don't remember that the lady midwives wore, I don't think any of us wore white. It was kind of blue. Checker or something.
Okay.
I really don't remember. Let me stop it. Let me
Okay.
stop. So I can tell you a story.
And everybody had some kind of bag. What
Everybody.
color was yours?
Black.
Okay.
Black bag.
Well, and tell me about the utensils that were in your bag. What did you need and use?
Actually, I did most of I did my deliveries in the hospital, so there was
Okay.
no specific bag, and of course, there's the regular utensils that you would use.
Mm-hmm.
But the midwives had, the lay midwives did have, and it laid out, and that information you could get almost from anywhere. Perhaps some of the others that you interviewed could give you those details.
Mm-hmm. Okay. Okay. Very good. I am so excited and thank you so much for doing this interview.
I appreciate you for letting me share this story. I recognize it's a little unique and different from the lay midwives.
Right.
My journey is my journey.
Right.
But I was so pleased to be able to tell their story. I got an opportunity to speak at a midwife conference in Geneva, Switzerland,
Okay.
and to tell the story of the University Medical Center,
Beautiful.
working with the midwives, the midwifery program, and the lay midwives, and the fact that working with the lay midwives, teaching them about sanitation and caring for the mothers and teaching the mothers and being with them up to 6 weeks had actually reduced the infant mortality rate
Great. Great.
in Mississippi. And so that was a positive thing that I feel where the certified nurse midwives,
Mm-hmm.
which I was, had contributed to raising the level of education and care that the midwives, the lay midwives were.
Right.
And the mothers, the children, the families were benefiting
That's great.
from this.
That is great. Now that you're retired, are you doing any volunteer work in that area?
No, I am not. Actually, let me tell you what I am doing. I am working with an organization called the Medical Institute for Sexual Health,
Okay.
trying to help young people have a better view, a better understanding, and therefore better behavior, healthier behavior about their
Right.
sexuality. Because I would say lack of knowledge. When people perish for a lack of knowledge,
Right.
they don't fully understand. And so I'm working with them to help not only the young people to get a better understanding of sex and risk,
Mm-hmm.
but what they can do to avoid and prevent
Right.
the consequence, the negative consequences.
Mm-hmm.
Also working with parents, helping parents know how to talk to their young people about sex. And again, behaviors that will avoid the risk.
Right.
Yeah, so that is almost a full-time job.
I know.
So
I know.
people say, I'm really not retired because I'm still out teaching and working with that
Okay.
specialization, helping young people make better decisions
Right.
with
Right.
the information.
Okay. And what did you say that organization's name is now? Okay.
Um, it is the medical that organization
Right. Right.
is the Medical Institute for Sexual Health.
Okay. And it's sponsored by UMC or?
No, it's in Austin, Texas. Austin, Texas.
Oh, okay. Great. I have a granddaughter down there.
Must give me your name. I'm there monthly. I'm in Austin once a month.
Once a month? Okay, and when you're there, you go to the hospital or to a clinic?
I actually work with anybody who will allow us, anybody who will invite us. So I work with churches, I work with community organizations, pregnancy care centers, as well as
Okay,
outpatient
in,
health department. I do not work with hospitals.
okay,
So this is an educational process.
right, okay. Very good. Okay, I like that, and I want to talk to you a little more about that. Okay, thank you so much for having shared all this good information with us. Now, if you have any artifacts or anything that you want to share,
Well, I'm going to look for the article. I really am. I'm going to look for the article.
Okay, very good. Thank you for that. All right, we're signing off, and I've been speaking with Dr. Frida Bush.